Hi, everyone. Thank you for joining me today to take a closer look at this study that looked at mindfulness-based cognitive therapy, MBCT, to treat generalized anxiety disorder, GAD. This was a study done in 2008 by Susan Evans and her colleagues. So we're going to go over the rationale for the study, the methods used, any results and conclusions, and implications and any limitations. So the rationale for the study. So generalized anxiety is a disorder that's characterized by long-term, intensive, and excessive worry. It's chronic. It's relatively common. It's a relatively common disorder with high rates of comorbidity, oftentimes with depression. And CBT has been found effective in treating generalized anxiety disorder. So why then something else if CBT is working fine? So GAD. Current treatments, people complain of residual symptoms, meaning the symptoms of their excessive worry tend to return. So cultivating mindfulness may be helpful because the nature of GAD is that it's the worry is future oriented. So being grounded in the present moment would help alleviate some of that stress. So MBCT was derived from MBSR, which was developed by John Kabat-Zinn, who has been given a lot of credit for bringing mindfulness practice into the mainstream, into clinical practice. And MBCT has been found to help with relapse in things such as major depressive disorders. So would it do the same for generalized anxiety disorder? So the overarching goal of the study then is to look at and investigate whether an open trial of 8 weeks of group MBCT intervention focused on intensive mindfulness meditation training with cognitive behavioral therapy training known as MBCT, if that would be an acceptable and effective treatment for treating patients suffering from GAD. So the methods used, so there were certain inclusion criteria in terms of age, fluency in English, medical status, and of course meeting DSM-4 criteria for GAD. There were some exclusion criteria as well, some comorbid symptoms, any suicidal or homicidal ideation, things such as that. So eligible subjects were brought into a lab and they completed measures on anxiety, worry, depressive symptoms, mood, mindfulness awareness in everyday life at baseline and at the end of treatment. So these were some of the measures that were used. You can take a look at the years they were developed and the number of items each measure has. So as far as the intervention itself, there were 2-hour weekly sessions led by an experienced clinical psychologist who was trained in MBSR and conducting things such as body scan meditation, sitting meditation, and gentle hatha yoga flow meditation, mindfulness eating, mindfulness walking, and aspects of cognitive behavioral therapy such as associations between worried thoughts, mood, and behavior were introduced. They were regularly given homework, asked to listen to meditation CDs daily. So in terms of looking at the results and conclusions, so 36 subjects were initially scanned for the study, 12 and it's a point to note that this was a highly educated cohort. So the results basically was that there was statistically significant reduction in anxiety, worry, mood, and depression from baseline to the end of treatment. So if we take a look at this diagram from the study, if you look at the mean between baseline and post, you'll see a significant reduction. And in terms of drop in clinical significance to non-significant range, the number of subjects that were in clinical that dropped to non-significant from pre to post. So the conclusion is that MBCT is an acceptable and potentially effective treatment for reducing anxiety and mood disorder symptoms and increases awareness in everyday experience in patients with GAD. So thinking about the implication of the study. So the anecdotal data that was collected from the participants of the study found that most of them had a very positive experience and they experienced positive change, and they said that participating in the study, they received something of lasting value and overall benefit in lots of spheres, social spheres in their life. And in terms of mindfulness, the entire group as a cohort was scored quite low at baseline as compared to the normative sample. However, in the post-study, they all came up to the average. So this is significant because even though it didn't reach statistical significance, it pulled them up to the average. So thinking about mental health interventions are often to pull people up to the average, but does mindfulness practice, because of its simplicity, have the potential to move the normative average up and higher? A few limitations of the study was that it was a small, non-randomized cross-sectional trial. Findings cannot be generalized to people who also have major depressive disorder, and because this was a highly educated cohort, it can't be generalized to other people just in general with GAD. I think moving something that the study highlights is that conducting a randomized controlled trial might be something to consider for the future, and this was the source. So thank you very much for joining me today in looking at this study. Take care. Bye-bye.